So in this section, we're going to be looking at how to tell if your baby is getting enough milk. Now, first things first, we want to be able to tell when your baby is hungry. So one of the things you can look out for is something called feeding cues. These are cues or signals that your baby is ready for a feed and needs to go to your breast. So let's have a look at what they may look like, because there are 3 different types of cues. So the earliest cue that you may see, which is your baby saying, "I'm hungry," is your baby starting to stir. Perhaps they're opening their mouth and they may be turning their head side to side and seeking out or rooting for your breast. If we miss these cues or we don't respond to these cues at this point, we move on to the mid cues. And this is your baby saying, "I'm really hungry." So you may notice your baby really stretching out and moving a lot more and really increasing that movement. And they may start bringing their hand up to their mouth and sucking on their hands. If we don't respond to these cues, we move on to the late cues. And this means that we then need to calm the baby first before we can feed them. So that may look like your baby crying, lots of movement, and they may be turning red in their face. This can make latching a baby onto the breast really challenging because your baby has gone past the point of hunger. So calm your baby first by bringing them close to your chest, up towards your neck, and just talk to them, soothe them, calm them down, and then go back and try again. So looking out for your baby's early cues can be a really good way for you to be able to recognise when your baby is hungry. And this will really help your body to respond to your baby's needs in terms of how much milk to make in those early weeks. It can be helpful to be aware of the impact of a dummy at this point. Many parents wonder whether they should buy a dummy, if they should be using one at all. Now, with dummies and breastfeeding, is the dummy can sometimes hide the early cues and even the mid cues until the baby gets really, really hungry and then spits the dummy out and starts crying. This can make breastfeeding quite challenging. So it may be worth thinking about the impact that the dummy might have on missing those cues and the impact that that can have on milk production as well as responsive breastfeeding. So responsive breastfeeding basically means responding to cues. So you're responding to your baby's needs. Now the good thing with breastfeeding is you cannot overfeed your baby and you can't spoil a baby. So you can use breastfeeding to your own benefit too. So if you feel quite full and you need to feed, perhaps you're thinking, "Oh, I've got the school run in 15 minutes. I could really do with a feed now." Or you might just want to have a snuggle with your baby and put your baby to the breast. You are responding to not just your baby's cues, but also your own cues that perhaps you might like to sit down and have a feed. And maybe the stack of dishes lining up next to you is not so appealing, so you want to sit down and feed the baby so that maybe someone else jumps in and does those too. So responsive breastfeeding is all about responding to cues and enjoying that relationship together where you can use the breast for not just food, but for comfort, pain relief, and also for your own sanity as well.